After waiting in anxiety, you finally receive your COVID-19 results. It's positive. EWN gathered all the information you need to know on what steps to take after finding out you are infected with COVID-19. After receiving the news, you will either be told to self-isolate at home or be admitted into a facility managing the outbreak. Your healthcare provider is primarily responsible for your care. You may be visited by a government official, community health worker, or by the National Institute for Communicable Diseases. The purpose of the visit is to assess if your home is suitable for isolation, assist you and those who are living with you to adhere to home isolation recommendations, and monitor your illness. If you were told to self-isolate at home, it means that you have been assessed as having mild illness or no or few risks for severe illness that can be managed at home. You will be asked to make a list of all the people you had close contact with before you became ill. Your contacts will be required to quarantine at home for 14 days and to keep checking their symptoms. Who is a close contact? Someone who had face-to-face contact within 1 meter or were in a closed space for more than 15 minutes with a person with COVID-19. Self-isolation. What does that mean? Stay at home. Do not go to work, school, or public places. Do not travel, and no visitors in your home, and keep separate from housemates. This is to help prevent the spread of coronavirus to the general population. If you live alone, make sure you have your healthcare provider's contact information on hand for emergencies. Ask friends or relatives to help you buy groceries or essentials. Or, if you have internet access, order your groceries or medication online, but have the delivery driver leave your items outside your house. Delivery drivers should not come into your house at all. While there is no vaccine, you can treat COVID-19 symptoms. Aside from prescribed medication from your healthcare provider, you can take over-the-counter medications if you have fever or pain. Make sure you rest and drink water or clear fluids during the day to make sure that your urine stays a pale, clear color. If you live with other people, stay and sleep in a separate, sick room away from the members of your household. If a separate room is not possible, try to keep to one area of your home, at least 3 steps away from other people. Wear a disposable face mask, not a cloth mask, to prevent spreading the virus to other people. While there is no evidence that pets or animals can be infected with COVID-19, limit your contact with them. When coughing or sneezing, cover your mouth with disposable face tissues. Maintain proper hygiene protocols, especially frequent hand washing. If you're living with children, or the elderly, or the vulnerable, try to reduce your contact with them as far as possible. If you are breastfeeding, take precautions to limit the potential spread of COVID-19 to the baby, wearing a mask when breastfeeding. Wash your hands before touching the baby or bottles. Avoid coughing or sneezing on the baby while breastfeeding. Consider asking someone who is well to feed your express breast milk to the baby. If you are feeding with formula or expressed milk, sterilize the equipment carefully before each use. The sick room. You should clean your room daily. First, use regular soap. After rinsing, use regular household disinfectant containing 0.5 sodium hypochlorite. You should use separate eating and drinking utensils, towels, bedding. Do not share with others. Take your meals back to your room to eat. Shared spaces should be well ventilated and cleaned after use. If a fan is available, point it out of one window and keep another window open to facilitate increased air exchange in the room. Minimize the time you spend in shared spaces. If you share a kitchen, avoid using it at the same time as others. The caregiver looking after you should wash hands after any type of contact with you. The person cleaning your sick room or bathroom should use personal protective equipment, including single-use or utility gloves and a plastic apron while cleaning. Your laundry should be placed in a bag. Do not shake soiled laundry to avoid spreading the virus through air. Machine wash laundry should be at 60 to 90 degrees Celsius with regular detergent, or wash laundry using regular laundry soap and hot water in a large container using a stick to stir. Hang washing outside to dry in the sunlight. Keep your mental health in check by keeping in touch with friends, family, and colleagues. Social support is critical. Stick to routines such as having regular meal times, bedtimes, and exercising. If you feel you are not coping, it is important to talk with a health professional. Continue to monitor your symptoms. If you get worse, contact your healthcare provider immediately. If you develop emergency warning signs, get medical attention immediately. Emergency warning signs include trouble breathing, persistent chest pain or pressure, coughing up blood, becoming confused, severe sleepiness, blue lips or face. Do not take public transport to the hospital. Either use private transport, preferably with windows rolled down, or call emergency services for an ambulance if required. Wear a face mask if you travel to seek hospital care. The period of self-isolation is 14 days, which starts on the day your illness began. That is, the day you first developed symptoms. But if you were tested positive with no symptoms, self-isolation ends 14 days after the positive specimen was collected. After this period, you are considered to no longer be infectious, and no follow-up lab tests will be required.